Did you know that over 25 million people in the United States alone have asthma? That's closer to the entire population of Texas. Asthma is a chronic lung condition that affects the nasal airways, making breathing harder. It can be quite tough for those dealing with it, so it's essential to catch it early and manage its symptoms properly. So in today's video, let's talk about the 7 early signs and symptoms of asthma that people always ignore. Pay close attention because you might have experienced some of these symptoms without even realizing it. Number 1. Frequent coughing. Coughing a lot is one of the first signs that show you might have asthma. The reason is that the narrowed airways in asthma get easily irritated by things like dust, pollen, too much exercise, and sometimes even cold air. When these things bother the sensitive airways, the body's natural response is to cough to clear out the irritants to make breathing easier. The problem is that many people don't realize that their frequent coughing could be because of asthma. They might think it's just a temporary thing and blame it on other things like the common cold, allergies, or smoke. But if your cough isn't going away, especially at night or after doing exercise, it's important to pay attention to it. And if you are experiencing shortness of breath with it, then it's best to go and talk to your health expert about it. They can determine if asthma is the cause and give you the right treatment to correct your breathing. Before we move on, please take a moment to subscribe to the channel and hit the bell icon. If you find our videos helpful, please support us by becoming a patron. Number 2. Shortness of breath. Imagine you're breathing, taking in air, and letting it out smoothly. But suddenly, you start feeling like you can't catch your breath, like there's a weight on your chest. That's shortness of breath, and it's a common symptom of asthma. Now, asthma can seriously affect your airways, those tubes that carry air in and out of your lungs. When you have asthma, these airways can become narrow and inflamed. So when you try to breathe in, it becomes harder for the air to flow through those narrowed passages. And did you know that the muscles around your airways can tighten during an asthma attack? It's like they're squeezing the airways even more, making you breathe harder. So don't wait for it to go away on its own, and consult a doctor before it gets more complicated. Number 3. Wheezing. Wheezing is like a special sound that you hear when you breathe. It's like a high-pitched whistle or a squeaky sound coming from your chest. Imagine your lungs are like rubber balloons with tiny tubes that carry air in and out. Normally, these tubes are open, allowing the air to flow smoothly. But in asthma, these tubes can become inflamed or swollen. It can also happen when the muscles around them tighten up, making them even narrower. That's when you might hear a whistling sound from your chest or throat. So when you hear such sounds, especially when you exhale, it could be a sign that your airways are starting to act up. It's like your body's early alarm system telling you to pay attention and get yourself checked. Number 4. Chest tightness. Chest tightness is another early sign of asthma that shows your lungs are working harder to get the air in and out. It can happen when you're exposed to triggers like allergens such as pollen or dust or irritants like smoke, and sometimes even strong fragrances. Basically, asthma has a tendency to make your nasal airways more sensitive, causing them to overreact to allergens or irritants. So if you often feel tightness around your chest whenever you smell smoke, pollen, dust mites, and strong fragrances, it can be an early sign of asthma that you may not be aware of. Number 5. Fatigue. We usually think of fatigue as a feeling of extreme tiredness and lack of energy. It's like when you're worn out and just want to rest or nap. Feeling tired is quite normal if it happens after working harder, doing exercise, not having enough sleep, or as little as having a mild fever. But if you are feeling tired without any obvious reason, it could be because of asthma. When it comes to asthma, the airways of your lungs become swollen, inflamed, and narrow, making it difficult for air to flow in and out smoothly. This narrowing of the airways can restrict the amount of oxygen that reaches your lungs. Oxygen is essential for your body to produce energy. When you don't get enough oxygen due to narrowed airways from asthma, it can make you feel exhausted and lacking in energy. Not just that, but this fatigue or lack of oxygen can also trigger your lungs to work harder to make up for oxygen deficiency. That's when you may experience shortness of breath and fatigue together. Plus, this extra effort to get enough air makes you feel more tired and drained, even if you haven't done anything physically demanding. Number 6. Respiratory infections. Certain respiratory infections, sometimes as ordinary as a mild flu or common cold, can become a trigger for asthma attacks. Even many people who have never had chronic breathing conditions can get asthma, and that can happen due to bacterial or viral infections that affect the respiratory system, including your lungs, throat, and nasal airways. Some common examples are the flu, cold, bronchitis, and pneumonia. When we get a respiratory infection, like a cold or the flu, viruses or bacteria invade our respiratory system. These microorganisms cause irritation in the airways. In response to this foreign attack, our body's immune system kicks into action. It releases certain chemicals in immune cells to fight off the infection. But when this immune response gets overactive and prolonged, it can cause inflammation in the airways. Together, all these factors contribute to the symptoms of asthma, such as tightness in the chest, difficulty breathing, wheezing, and coughing. Not just that, but these infections can make the cells in your nasal airways more sensitive, meaning they quickly react to allergens like dust, pollen, smoke, strong odors, and animal furs. So it's essential to never ignore any sign of respiratory infections and get yourself treated as soon as possible. Number 7. Allergic reactions. Allergy is basically how our body's immune system responds to certain elements called allergens. These allergens include pollen, dust mites, animal fur, strong smells, and certain foods. If you have any allergy and come into contact with an allergen, your immune system overreacts and releases certain chemicals known as histamines. These chemicals create an emergency response and trigger your body to expel the allergens out of the body. And that's mainly why the first step of the body's reaction to pollen or dust is sneezing. And yes, that pre-sneeze tickle sensation too. Similarly, if you have asthma and encounter an allergen, it can also trigger an asthma attack as an allergic response. The severity of this allergic response depends on the amount of allergen that you may have inhaled, the time it spends in your nasal airways, and the amount of histamines released by your body. The longer the histamines stay in your body, the more severe the reaction can be. Eventually, this prolonged reaction can cause your nasal airways, respiratory tract, and lungs to become even more inflamed and irritated. This makes it difficult for air to flow in and out, leading to symptoms like coughing, wheezing, shortness of breath, and chest tightness. So if you already are allergic to dust, pollen, or animal fur, and often experience these signs and symptoms of asthma, do not ignore them and get yourself checked as soon as possible. Thank you for watching and subscribing to the channel. See you in the next video.